The phenomenon of climate change has been increasing or accelerating at a crazy pace. That's because of most of the human activities in terms of burning of fossil fuels, etc., which generate certain kind of greenhouse gases, which harm the atmosphere by trapping the sun's heat, and then that leads to increasing temperature. But the point here is that although climate change is continuous, it's been happening, it's not new, but it's accelerated. So how does it impact our own health? The global impact is there as well as the regional impact. We know that there have been rising temperatures, there have been extreme heat events, weather events, and a lot of degradation of the environment. That means that it impacts what we eat, what we do, how we are able to live our daily lives, and it also, leads to flooding and many other phenomena that we saw, including vector-borne diseases and things like that from the previous presentations. It's a comprehensive picture that shows that climate change it affects various spheres of our lives, leading to air pollution, water quality, vector-borne diseases, etc. As an immediate side circle, but it also leads to very indirect and long-term implications in terms of injuries and deaths. So if we narrow down now in terms of climate change, which has of course air pollution and all other things, but if we look at heat as one of the things that climate change is leading to, we know beyond doubt now that heat is a huge hazard for us. It's a major environmental and occupational health risk. It's leading to many, many deaths, and it impacts human health in every possible way if we look at various organs of human beings. So it leads to cardiovascular conditions, diabetes, lung-related conditions, and accidents, and also leads to vector-borne disease transmission, which is increasing. Early warning systems, again, very important, and emergency response plans. In terms of, having good city designs, as well as low-cost interventions at various levels, and sharing of best practices.
The natural factors such as temperature, humidity, wind, storms, droughts, these are natural, as well as our human activities in this modern advanced society: industrialization, construction, vehicular pollutions, and sometimes the crop residue burning, very common in Delhi and Punjab, Haryana area, leading to air pollution. The previous speaker has rightly pointed out, have consequences on mental health, not only in physical health, in terms of depression, anxiety disorders, and suicide, etc. There is a schematic representation of the impact of climate change on mental health. Climate change will impact on the mental health in two different ways, direct and indirect. As it was also mentioned that heat, the global warming, is leading to many physical morbidity and even mortality. And before that, there are lots of discomfort we have to adopt. Consider non-traditional form of care such as travel, spirituality, community-based program, etc. Keep an eye out for symptoms of behavioral and psychological changes in your kids, inability to kids as well as the extreme of ages, differently able and pregnant women, etc. Inability to talk, bedwetting, worry or panic while not in danger, self-harm behaviors, and some examples of such changes amongst the children are significant telltale signs. Look out for authentic information issued by the government. Engage in active listening with those who would like to talk to you. Online platforms and peer support groups can help in the management of mental health issues. Take-home message will be climate change is an urgent global challenge. We should not ignore the mental health aspects of impacts of climate change on human health along with the other concerns. While the challenge is significant, we have the knowledge and capability to address it if we act decisively.
We need this platform, we need this conclave, because as health professionals, we have a duty to be a part of the solution. So what is to be expected in climate change? So there is a long list which has been listed by in the Indian Journal of Medical Research by a group of researchers way back in 2013, and there it is clearly mentioned that there will be a change in the range, distribution and incidence of the outbreaks of vector-borne diseases as a result of climate change. Animal, plants and our shared environments, recognizing the interconnectedness that is within these stakeholders. So we need to involve. What is important is that for us health professionals, we need to involve, we need to act as a community along with the veterinary fraternity, environmentalists, forest department, individuals, community, so that we have a good strategy to tackle the complex health threats in an integrated manner. So these are the adaptation strategies for responding to the vector-borne disease. We all know this, but the last one, this is what we have been doing: public awareness and engagement campaign. This is what the Ahpicon organizers have been doing for the last 2 years, organizing many events in colleges and in the university, and that is the aim. We are fulfilling this strategy.
We really need to adapt to the changing environment and also maintain the functionality of the healthcare organizations. Defining climate resilience, number one, there are 3 factors. One is the adaptation. The number 2 is resilience, capacity to recover quickly from the difficulties. And the third one is the sustainability. Now, if we look at the conventional healthcare infrastructure, it is designed by, in the Northeast, we do consultancy services, and when we interact with the hospital owners, we find out that most of the hospitals are designed by the doctors and the general engineers or architects. What happens is, in that case, your energy efficiency is not there. Your energy usage is high, your water systems, that is on the higher side, the usage, and also the materials that are used in the hospitals. An engineer or an architect without knowledge of hospital designing might, design a very good hospital building, but not necessarily a patient-friendly and a doctor-friendly hospital.
We have the National Action Plan on Climate Change drafted by the Ministry of Environment and Climate Change in the year 2008, and later 4 other missions, including the National Health Mission, was included, and the National Action Plan on Climate Change and Human Health was drafted in the year 2018. And this program, that is the National Program on Climate Change and Human Health, was launched in the year 2019 February. We are all vulnerable to these extreme hazards of climate change, but some population, like children, women, those living with underlying health issues, marginalized group of population, and displaced persons are more vulnerable to these extreme events. Now, the natural greenhouse effect, it keeps the surface of the earth warm for the survival of the human beings and lives on this earth. But when these greenhouse gases, mainly the carbon dioxide, methane, chlorofluorocarbons, nitrogen dioxides, ground level ozones, and the pollutants like sulfur dioxide and black carbon consisting of PM2.5, PM10, are drastically increased in the environment, it leads to short-term and long-term impacts on human health.
From Arctic to Manipur, the signs are clear. Rising temperatures, extreme weather events, and changing disease patterns are threatening lives across the globe.
Vector-borne diseases are on the rise. Dengue was a news some years back, but today we are facing it even in the state of Manipur.
Manipur become very high risk in drought and flood today. Desertification is very high. So act now or never.
But together, we can build resilient healthcare systems that protect our communities.
Collaboration is the key to health security in the face of climate change.
Join leading healthcare professionals, policymakers, and climate experts at the first Ahpicon NE II 2025.
Distinguished doctors and specialists from within and beyond the Northeast will join this initiative, fostering meaningful discussions and innovative solutions. The goal is to strengthen the healthcare ecosystem's resilience against environmental challenges, ensuring a healthier future for all. Pena Hiran to present a beautiful piece. His enchanting performance will set a serene and dignified tone as our dignitaries take their seats on the dais. Ladies and gentlemen. Now it is time to invite our esteemed dignitaries to the dais. We are honored to have distinguished leaders and experts among us today, whose contributions and insights will add immense value to this conclave. So first of all, may I request our respected chief guest, Shri Professor N.G. Vijay Singh, former Director of REAMS, former Vice Chancellor of Manipur University, and ex-MLA, Krai Assembly Constituency. May I have the privilege, Dr. Palin Kundombam, President, API Northeast 2 and Organizing Chairman, Ahpicon 2025. Professor G. Sunil Kumar Sharma, Director, Regional Institute of Medical Sciences, Imphal. May I have the privilege to invite on stage Dr. Taurambam Rajakumar, Director, Directorate of Environment and Climate Change, Government of Manipur. And also would like to request our Organizing Secretary, Ahpicon 2025, Dr. Kumanthi Ratan Kumar Singh to be on the dais. And last but not the least, Dr. Sorokhaiba Jugindra, Chairperson, Reception Committee, Ahpicon 2025. Ladies and gentlemen, please join me in welcoming our respected dignitaries on the dais. Our dedicated Dr. Ashit Kumar Devnath, Chairman, Scientific Committee, will have the honor of presenting this token of gratitude to our distinguished guests. Professor N.G. Vijay Singh, former Director of REAMS, former Vice Chancellor of Manipur University, and ex-MLA, Krai Assembly Constituency. A replica of Pena. Founder and patron of Ahpicon NE II. We welcome you, sir. Thank you so much for your gracious presence. traditional stole, lingyan, a bouquet, and a replica of pena.
I would request the President to allow me to do it in a traditional way, which is by giving a bow. Traditionally, for all Manipuri functions, we bow down on the floor, and first to the east and then to the north to welcome all, and not only to welcome them, but also to invoke the universal forces to make the program a big grand success.
Now, in an effort to impress sustainability and honor nature, we replace the traditional lamp lighting ceremony with something deeply symbolic, the watering of Tulsi plant. This simple yet profound act signifies growth, resilience, and our shared commitment to a greener future. May I now invite Dr. Kumar Singh, Organizing Secretary of the first Ahpicon NE II, to deliver the keynote address.
As we are aware, global warming, as we have seen, listened from all the speakers who had presented on previously in the sessions, is one aspect. Global warming is one aspect which we wish to contain for life on Earth to sustain. The aim is to limit global warming to 1.5 degrees Celsius at the end of the century. If we look at the scenario, 60% of the emissions are contributed by 10 countries with maximum emission, whereas only 3 is being contributed by least emitting countries, where the least emitting countries are getting the brunt of climate change and its ill effects. We want to bring up some actionable programs where we can suggest the governments, the stakeholders, and the people who are really interested in having this art to work together. And then we want to put up after the conclave, we want to put up a summary where we can present those actionable plans for further actions.
It is my pleasure to invite Dr. Shyam Kumar Laisham, editor of Nongobi, and Mr. Pramod, assistant editor, to join our chief guests and esteemed dignitaries on stage for the release of the souvenir Nongobi. Thank you very much, and it is our privilege to launch the NABH Guidebook for Climate Action and Sustainability in Healthcare, a vital resource to help healthcare institutions adopt sustainable practices and enhance climate resilience. May this initiative pave the way for a greener, more sustainable future. So I would like to request our fellows from different organizations. First of all, Ngao Suraj Kumar Singh from People's Chronicle, ladies and gentlemen. Api Manipur Media Fellowship recipient. Thank you very much. Next we have Yaifaba Meitei Kharibam, Shanghai Express. And we have Enambam Ojit Kumar Moshu, Impact TV. And also would like to request Laima Popam Kavichandra Meitei, Impact TV, for the competition category painting. M. Jackson Singh, ladies and gentlemen. Second position, H. Sanahal Singh. And the third position of the painting competition, Laitonjam Bankim Chandra. Winner of the essay competition from Manipur University, Moirangthem Kishan Singh, ladies and gentlemen. And second position, Nomthombam Anjali. And third position, Elizabeth Hilton, ladies and gentlemen. Next we have extempore competition, and the winner is Ronaldo Ahong Sampam. The first, please. Congratulations. And the second position, Prithvi Raj Huicho, ladies and gentlemen. And third place goes to Anubam Sanjana Devi. And next is the debate competition, and the team winner is Caesar Academy of Health Sciences. Our winners are Konjengam Swapna Chanu, Simran Laisham, Selina Moirangthem. Simran Laisham and Selina Moirangthem. And next category we have is extempore competition held at Ima Hall Lumpville, and the winner is P. Kairala Gracie from Jawaharlal Nehru Institute of Medical Sciences. Second place goes to Raj Kishore Ningombam from James. And the third place is tie between three contestant participants, Nikita Hirom, Athena Ninthosam and Sanjivani Das. First, Nikita Hirom, the third place of the extempore competition. And next we have Athena Ninthosam from Churchandpur Medical College. And Sanjivani Das from Caesar Academy of Health Sciences. And the last category, that is painting competition. First place, Prinika Chongtham from James, ladies and gentlemen. And next, Alex Kamabam from Churchandpur Medical College. May I have the privilege to request our respected guest of honor, Dr. Taurambam Rajakumar, Directorate of Environment and Climate Change, to share your thoughts with us.
We all understand it. Climate change is a complex new science and becoming the most serious environmental problem. Many projections of climate factors though conventional, are now being observed. Extreme climate events are increasing in scale, frequency and intensity. It is directly contributing to humanity's emergencies from different factors like heat waves, wildfire, floods, droughts, tropical storms, hurricanes, etc. Considering the urgency of sustaining the climate action, it is very urgently needed to have preparedness of health security, structured knowledge networking, and emergence of all stakeholders. Very fortunate to extend my gratitude to the state government, that the state government being an agency by this government of Manipur for climate change, the Directorate of Environment and Climate Change could bring out the action plan of climate change of the state in 2013. It is very fortunate again to extend my gratitude to all my colleagues, all the climate change scientists, all the nodal officers from the all 9 departments, to work together to bring out the second version of this our SFPCC, that is State Action Plan on Climate Change, which is one of the dedicated chapter is for health sector.
And may I have the privilege to request our respected guest of honor, Professor G. Sunil Kumar Sharma, Director, Regional Institute of Medical Sciences, Imphal, to address this August gathering.
The health impacts of climate change are diverse and complex. Rising temperatures and shifting weather patterns are contributing to the spread of vector-borne diseases such as malaria, dengue, as well as waterborne diseases. The changing climate is also exacerbating mental health conditions as communities face uncertainty of unpredictable environment events. Our role as a healthcare provider, researchers and policy makers is to advocate for solutions that integrate environment health into public health programs. This includes promoting sustainable practices, reducing carbon emissions, ensuring access to clean air, water and nutrition for all.
And may I now request our respected guest of honor, Dr. Alexander Thomas, founder and patron of Ahpicon and NE II, to address the gathering.
The greatest threat to humanity is not the wars, it's not this, it is climate change. And if you don't take care, we're going to be in trouble soon. So through this network of HPI, ANBA and KAO, PHR Vice Captain Raj is here, and we have started something called Health Environment Leadership Platform, which is also a co-sponsor of this program. And here we are focusing only on the health sector and climate change. And over the years, we have done some activities. The first ever national level conclave on healthcare, health sector and climate change was done in 2019 in Delhi. We sent recommendations to the government. Many of it has happened. Some of the NABH standards have also come in. That was one of the recommendations. We brought out the first book on the health sector and climate change. Many hospitals are using it. It's available as a free download. And through this help, we hope that we'll be able to actually impact this very important issue.
And may I now have the privilege to request our respected chief guest, Professor N.G. Vijay Singh, former Director of REAMS, former Vice Chancellor of Manipur University, and ex-MLA, Khura Assembly Constituency, to address the August gathering.
I'm extremely happy to know that the Association of Healthcare Providers India NE II Manipur chapter is in collaboration with other stakeholders is organizing the first Ahpicon NE II 2025 Manipur chapter. This pioneering conclave will provide a platform for expert policymakers, healthcare professionals to deliberate on strategies to mitigate the health impacts of climate change and hence the resilience of healthcare system in the region.
And now may I have the privilege to request our respected President, Dr. Palin Kunongam, to deliver the presidential speech of the inaugural ceremony.
In Manipur, we are already witnessing the devastating effect of climate change. Warming temperature are altering the distribution of disease and food chain, while extreme weather events are straining our healthcare infrastructure. But today, we are not here to merely diagnose the problems. We are here to explore the solutions, to share knowledge, and to forge partnership that will help us build a more resilient healthcare.
As to conclude the inaugural ceremony, may I now request Dr. James Elangum, Joint Organizing Secretary, Ahpicon 2025, to propose the vote of thanks.
I would like to thank the respected and well-known faculties from outside the state for being here with us despite the challenges of today's Manipur. Thank you so much for being here and sharing with us your beautiful thoughts. Over the last 4 to 5 hours, we have come to know that life is fast, but climate resilience demands our life to go slow. So I leave you with the question, have we gone too fast? Should we slow down to save Mother Earth? Thank you so much. Enjoy the rest of the evening.